This illness, fibromyalgia, is very complicated. As many of you know, most doctors don't want to treat fibromyalgia. Many clinics turn them away. Unfortunately, these patients have been to an average of 12 doctors and have had the illness an average of 7 years before they ever get the diagnosis. So they've been around the block a little bit. Now, by the time they get to my practice as a little old chiropractor in Birmingham, Alabama, and they come from all over, they've been everywhere and tried everything. They're desperate. No physician would really choose to work with these individuals. And unfortunately, many physicians think they're crazy, or they have a Prozac deficiency, or they're just lazy. And nothing could be further from the truth, because they're people just like you and I. What I have learned over the last 10 years working with fibromyalgia patients is they can be some of the most rewarding patients to care for, because if you can help them, and today I'm going to share information with you that will help you see just how to do that. If you can help these people, they will name their children after you. Entire support groups will beat a path to your door. You'll never have to advertise again. You'll have a busy practice. These people are so grateful to get their lives back. Fibromyalgia, what is that? Well, for many of us in the audience, we think of fibromyalgia as kind of a waste paper basket diagnosis. If we don't know what it is, we put a label on it, we give them a rubber stamp, and it says fibromyalgia, and basically it says, we don't know what the world you got, but you got something. And unfortunately, for those people with fibromyalgia, they have been left to the rheumatologist, the specialty of rheumatology, to both be treated by rheumatologists and also write a lot of the papers associated with fibromyalgia. The unfortunate part about that is this, is traditional medicine alone has come up blank against fibromyalgia. That's one reason why they don't want to treat these people, because they don't have an answer for people with fibromyalgia. You see, fibromyalgia is so far outside the traditional medical box, they don't know what to do with them. There's no cookbook recipe in the Merck manual for fibromyalgia. So you have to think outside the box. The only doctors that are having success with fibromyalgia are doctors who are doing integrative medicine, combining judicious and effective use of prescription medication and all the natural things that we're going to talk about today. Those are the people that are having the success. On the American College of Rheumatology's website, they say that their go-to medicines for fibromyalgia, Elavil, which is a tricyclic antidepressant, Flexeril, which is an older muscle relaxer, and Klonopin, which is a benzodiazepine or a tranquilizer. Those three medications, which have been used predominantly as the foundation to treat fibromyalgia patients with traditional medicine, are no better than a placebo after 3 months. No better than a sugar pill. They go on to say that the studies show that they don't recommend, based on the studies, they don't recommend that patients take pain medication. They don't recommend patients take non-steroidal anti-inflammatories. And of course, we all know about Vioxx and Bextra and these others. They go on to say they don't recommend they take benzodiazepines or tranquilizers. They don't recommend they take long-term sleep medication like Ambien, because these medications don't work quickly wear off, lose their effect, and they all have potential side effects. So basically what they have said is, good luck. And that's why so many medical doctors out there, and even non-allopathic doctors out there, are so intimidated by fibromyalgia. Well, for those of you who don't really know what fibromyalgia is, let me just share with you that real quick. A lot of the information that I'm going to be presenting comes out of 2 books. One that you have that I passed out today is a book I wrote 2 years ago. It's available in the bookstores. And then the other book is a manual that I wrote primarily for non-allopathic physicians. And it's the same title, but it's the manual for non-allopathic physicians. Let me just share this with you, and then we'll get to the nitty-gritty fun stuff. But the diagnostic criteria for fibromyalgia was first introduced in 1990 by the American College of Rheumatology. So to their credit, at least they gave this some validity. Up until then, and still even as I speak around the country, many doctors still don't believe in fibromyalgia, and I'm sure you run into that, right? Well, the brief criteria is a history of widespread pain. Pain is considered widespread when all the following are present. Pain in the left side of the body, pain in the right side of the body, pain above the waist, pain below the waist. Basically pain everywhere. And that's what these people have, is diffuse muscle pain throughout their body. Now, to qualify, they also should have palpable, where you can actually touch and feel, and elicit pain in 11 of 18 trigger points. And those trigger points are spread out through the body, and you have a diagram in the book that you have. But really, here's the real thing about fibromyalgia. It doesn't matter whether they have 11 of 18 trigger points. That doesn't matter. It doesn't matter if they have diffuse pain all over or not. What matters is this. If you have a patient that comes to your office and they're having trouble falling asleep within 30 minutes and sleeping through the night, and they have chronic diffuse muscle pain, they either have fibromyalgia or they're heading that way. Now that really incorporates a large population, right? And that is one reason why so many people do have fibromyalgia, because what we're saying is people with sleep disorders and pain either have fibromyalgia or they're heading that way. And that's basically the criteria I use to diagnose these people. Now they also have a laundry list of all these other symptoms, and that's why oftentimes they are looked upon as being crazy or having psychosomatic illnesses, because they have what? Depression and anxiety. They have fatigue. Many of them have chronic fatigue syndrome. We won't have time to go into that, but I discussed that, of course, in the books, as the title says. Chronic fatigue syndrome is really the same side of it's the same coin of fibromyalgia, it's just the other side. 70% of those with fibromyalgia are going to have all the symptoms of chronic fatigue syndrome. 70% of those with chronic fatigue syndrome are going to have all the symptoms of fibromyalgia. So the difference with chronic fatigue syndrome, as the name implies, the main symptom is what? Fatigue. And not the fatigue that you and I have from staying out too late and having a good time, but the kind of fatigue where you literally can't get out of bed. It's the flu from hell that never goes away.